Scopeguide 3D imager allows the endoscopist to monitor the looping and location of the colonoscope without fluoroscopy. 16 or more 2mm generator coils are built into the scope or are in a probe inserted down it. 10 times a second, each coil is energized by the field generator via a cord plugged into the umbilical. Each coil generates a magnetic field of different frequency, which is then detected by larger coils in the sensor dish alongside the patient. 10 times a second, the sensor coils identify the location of each generator coil as a data point. This information is analyzed by the signal processor, making a 3D graph. The signal processor data is then converted by the graphics unit into a 3D shaded image of the colonoscope. This real-time scope image is sent to the monitor and watched by the endoscopist. The image can be viewed from any angle. The low energy and low frequencies involved mean that Scopeguide is completely safe for continuous use, similar to being near a television monitor. This is an example of a classic insertion. The endoscopist, seeing the image, can avoid looping in the sigmoid, keeping the instrument straight as it passes inwards, up to the splenic flexure, then into the cecum. On the other hand, here the imager shows that an alpha loop is forming, a good loop because there's no acute bend. So the endoscopist should keep on pushing till the tip reaches the splenic flexure, and then withdraw with clockwise twist to straighten the scope. Here are the percentages of loops forming during a series of colonoscopies. N-spiral looping in about 80%, alpha looping in only around 10%, but a deepish transverse loop in about 30%. These are the commonest loops, but expert endoscopists not using the scope guide guessed them wrongly in over half the cases. Here are some of the atypical loops, less common and due to mobile colon attachments. None of these were correctly guessed by experts without scope guide. Scope guide 3D imager shows when a loop is atypical, such as this reversed alpha loop in the sigmoid. It's obvious that this is a counterclockwise spiral, so strong counterclockwise torque is needed during withdrawal to straighten the loop, rather than the usual clockwise twist. Scope guide can easily be switched to show the lateral view as well as the usual anterior view. This combined view shows the 3D shape better. It also helps decide whether a loop passes sufficiently anterior to allow hand pressure to compress it. If in doubt, a hand coil can be used by the assistant to target the exact point which best opposes the loop and makes scope insertion more efficient. Studies have shown that without using scope guide, sigmoid hand pressure is ineffective 2/3 of the time, either because the loop is inaccessible or because pressure is in the wrong place. Here, pressing exactly over a transverse loop helped make the scope slide in proximally. Here, attempted sigmoid loop pressure was ineffectual. Colonoscopy never ceases to surprise, and to be frustrating in some cases. Here, scope guide shows complex looping. In cases like this, even the most skilled colonoscopist needs scope guide to know what's really happening and exactly where the tip is.
I'm getting the best view I can. Jill, you
For
just
teaching or audit purposes especially, scope guide can transform colonoscopy from a matter of guesswork and feel into a logical procedure, sometimes a much quicker and more comfortable one for the patient too.